the first Oakland County resident has died of coronavirus or COVID-19, and our prayers and our sympathy and our love go out to their family and their friends. I wish I could tell you more information about that gentleman, and Leanne Stafford, our health director, will share what we can. But what I would say is this could be any of us. This could be your husband or brother or coworker, and this only magnifies to me the seriousness of where we are in this pandemic. We need to do all measures that we can to contain the spread of this virus and make sure that that number of people who contract the virus and ultimately the number of fatalities is as low as we can possibly make it. I'm not trying to scare people. In fact, this is not a time for panic, but this is a time for renewed and heightened measures to protect our public. Nothing is more critical to me, and I think nothing should be more critical to our residents as we work to protect our own families and our own lives. It was only about a month ago when I did my State of the County and I talked about the theme of Oakland Together, and that means a lot of things, but it has never taken on more resonance for me than it has during this pandemic. We are working together with our state partners, our federal partners, our local communities, hand in hand, to make sure that in a coordinated fashion, we're doing everything that we can to address the seriousness of COVID-19. I'm going to be announcing several new public health orders in Oakland County. I also want to stress that these measures alone are not enough, and we need everyone to do everything they can, voluntarily or by order if necessary, to keep ourselves safe. And one of the most critical ways that residents can keep themselves safe is to stay home, to not conduct non-essential activities in the county or in the region. Stay home. It is still the safest place for you, unless someone in your home is positive, and we'll talk a little bit more about what that means in a moment. Let me talk specifically about the health orders that I and our public health officer, Leanne Stafford, are announcing today. First of all, the malls in Oakland County are now ordered closed as of noon today. I'm grateful that a number of the malls have already taken this step. This will now affect all malls in Oakland County, and that is a prudent measure that we should take. It, I hope, gives you the message that unnecessary public activities should now cease. Playgrounds. We've had a number of questions from our local communities about what we do in terms of playgrounds, and in particular playground equipment. So let me just address that for a moment. It is still okay to go outside. It's not even a bad idea to go out to a large park where there are trails and other activity that you can get some fresh air. That's good for your health, as long as you can practice social distancing. 6 feet or more, small groups of people, the things that we've heard so much about. But when it comes to the playground equipment, we can't guarantee that that equipment is not infected by other children who may have played on it. So just to provide further clarification for our local communities, we are issuing a public health order that would close playground equipment and playgrounds, the parts of parks where playground equipment exists. You shouldn't play on the playground equipment at this time, and that is also now an order. We're going to talk about an additional order for child care centers in regards to screening the people who enter them, and I'm going to let Leanne, our public health officer, give you more specifics about that. And then finally, we're very concerned about individual living facilities, and I know the governor's order yesterday afternoon covered this in some detail and gave us guidance on what we should be doing, and Leanne is going to talk more specifically about the measures we're taking to fully implement the governor's orders as regards to independent living facilities as well. I know that this can feel like a very helpless time for our residents, but I believe that exactly the opposite is true. that the power is in our hands individually to slow the spread of COVID-19 if we all take important restrictive actions now. Everyone we don't infect is another person that doesn't have to get tested, another person that doesn't have to go to the hospital, and another person who potentially could die of this virus. And so limiting your exposure in the public is critical at this time. I mentioned our shopping malls, but we also know that other non-essential businesses are places where the virus can spread. And I want to encourage all of our residents to limit their non-essential activity starting now. This means health, this means hair care, this means getting your nails done, this means going mattress shopping. I don't want to pick on any particular business, but if it's not essential, you should take these steps today. As of now, that is voluntary, but I will tell you that we are coordinating with the governor and the statewide folks who are looking into this, and I believe more steps will be coming and need to be coming to make this requirement for all of our people. But we don't have to wait. The power is in our hands to limit the spread of COVID-19, and everyone should do everything they can. It's the hygiene messages that you've heard so much about, but social distancing is going to be a critical part of how we stop the spread. The other thing that I want you to know that we're looking into in Oakland County very actively is facilities where we can have people go that have tested positive. And I should mention, at this point we have 202 positive cases of coronavirus or COVID-19 in Oakland County, but we know that number is going to increase. It has been doubling, or almost doubling, every day for the last several days, and we fully expect that number to increase. As more testing is done, and we need more testing, we need more testing kits from the federal government, and we need the president and the federal government to give us more tests, more ventilators, more medical equipment, more PPEs, and all the like, and that's going to be critical, right? And we know that. But we also know that we can help slow the spread of this virus if people who are positive but are subacute, that don't require hospitalization at this time, to be in a facility where they can get medical care, but they can be away from their loved ones. One of the things that we've seen in Europe and Italy in particular is, and we've seen this in New York already, is that some of the most at-risk people are people living in a household where someone is positive. So we are working on locating facilities where we can allow positive people to go who are subacute, who do not require hospitalization at this point. And we'll have more details on that in the coming days. I'm very concerned about our hospitals. We have to preserve as many beds as possible for those who have acute symptoms. And we know that if we do nothing, we will overwhelm our healthcare system. And that has to be all of our priority, so that when one of your family members tests positive and has symptoms that are acute, we have a bed for them. That is critical. And we can all play our part by isolating ourselves, by distancing ourselves, and taking all of these measures. So if people ask, are we overreacting? I would say, absolutely not. There's going to be a new normal for us right now. And what we want the normal to be is a healthcare system that is not overwhelmed and fewer deaths in Oakland County. That's our mission. That is what we are singularly focused on right now as a health department, as a law enforcement agency, and Oakland County government in general. We are primarily focused on the health and wellness and safety of our residents. We have a number of other speakers that will address some of these issues. I'm pleased to be joined by our sheriff, who will talk about some of the enforcement mechanisms that can be used in this situation. He'll talk about some other issues as well. Leanne Stafford, as I mentioned, will give you a public health perspective. And I want to mention that I'm also joined by Tom Hardesty, who runs our EOC operations, and he's going to get more detail about this. But I want to implore people to contact our EOC if they can help us with these needs. We need more equipment. We need more masks. We need more ventilators. We need more gowns, right? We need more touchless thermometers. If you or your business has these equipment and you're not currently an essential business that needs to be open, maybe you're a dentist office who was affected by the governor's order yesterday, maybe you're another kind of facility that has access to this equipment, we need it. And I want to encourage you to contact our Emergency Operations Center, and Tom Hardesty will give you a number. For now, we want you to call us. We'll come pick it up. In the coming days, we'll have a drop-off center so that you can drop off these equipments. If you're a business that has these things or has the capability of manufacturing these things, I want you to reach out to us. We need your help. This equipment is going to be critical for our frontline workers, and let me talk a little bit about them. I am so grateful for the people who are in our healthcare system, our frontline healthcare personnel. They are doing a yeoman's job, and we need to keep them protected. We need to get them every piece of equipment that they need to do their jobs and keep us safe. So we will prioritize the equipment we get so that it reaches everybody that needs it in a critical fashion. This is not a time to panic. This is a time for Oakland County and the state to come together. I'm confident that together we can address the needs, but the seriousness cannot be overstated. So I'm going to say it again. If you don't have to leave your home, don't. Non-essential activity should cease as of today. So with that, I would like to call up Leanne Stafford, who is our public health officer, and she can give you some more information about the statistics and the death that we had, unfortunately, yesterday evening. Leanne.
Thank you. Yesterday, Oakland County Health Division received notification that a 50-year-old male had passed away at Ascension Macomb, Oakland. Our sincere condolences go out to his family and the healthcare workers that did everything possible to save this individual's life. Our case count is changing frequently. We actually are now at 225. We anticipate this number will continue to rise. With the availability of the 6 healthcare systems that we have here in the county, the 12 hospitals that we have, it allows for more testing. And it also, with a very mobile population that we have here in Oakland County, we anticipate that this number will continue to rise. Maybe even more than other counties, as you may have seen or in the numbers now. We are issuing, as Executive Kotler talked about today, 3 orders. The first one is really talking about screening all visitors, children, and this includes parents that are coming into a child care facility. This includes taking temperatures, asking if they have any signs and symptoms, if there's any travel history over the last 14 days, and even if you feel like you've been in contact with someone that's either a confirmed case or a suspect case, we're asking all child care centers to make sure they're screening for this. This correlates with a previous order that the governor put out regarding senior living facilities. So yesterday, she put out a announcement that this also included independent living facilities. So we're kind of working on that same realm that, screening is an important factor in public health. To further protect our kids, as Executive Kotler talked about, we're closing all indoor and outdoor playground equipment. And that's just to make sure, we're protecting our young children. And, as he said, we still want people to get out and enjoy the weather. Spring is here. It's just really making sure we're not on that equipment. And although most malls have voluntarily closed, we are issuing an order to eliminate gatherings in malls and so closing malls. This is the time that we really need to pay attention to our families and our communities that are the most vulnerable. These are the people that will experience the most serious illness. And those vulnerable are elderly and those over 60, those that have diabetes, hypertension, heart disease, chronic respiratory disease, COPD, and emphysema. So now I'm going to turn it over to Tom Hardesty, where he will talk about our Emergency Operations Center.
Good morning. As the county executive mentioned, the Emergency Operations Center for Oakland County has been open and active 7 days a week. The role of the EOC is to coordinate emergency support functions around the county during an emergency from various departments such as the health department, fire, EMS, law enforcement, and volunteer organizations such as the Red Cross, Salvation Army, and more. When an organization such as a hospital, an urgent care center, EMS, or even a doctor's office can't get the emergency supplies they need, they make that request for those supplies from the County Emergency Operations Center. If we can't fulfill those needs, we then make a request for those resources from the Michigan State Police Emergency Operations Center. Right now, our top priority is trying to obtain personal protective equipment for hospitals, for healthcare workers, for EMS and first responders. County Executive Coulter and the Board of Commissioners have provided us with great resources, including funds needed, but right now we can't find or get these supplies. We're looking for donations, as he mentioned, for masks, for face shields, for surgical gowns, for gloves, and for non-touch thermometers. The phone number where you can contact us is 248-858-5300. And we'll either make arrangements to pick those up, or you can drop off these donations beginning Monday at 9 a.m. at the Farmers Market at the corner of Pontiac Lake Road and County Center Drive. And that drop-off site will be open Monday through Friday from 9 a.m. to 5 p.m. You can also contact us by email at oakeoc, that's OAKEOC, at oakgov.com. With that, I'd like to turn it over to Sheriff Bouchard.
Well, thank you. Appreciate the opportunity to work with all of our partners up here, our county executive, our board of commission, our EOC, and our health folks. You know, everyone's pulling together and doing whatever they can on this. And as it relates specifically to orders, you know, I get an email, a Facebook post, or a call almost every couple minutes about barricades going up or arrests being made or martial law. None of that's true. Okay. These orders are intended to give people the way they can voluntarily protect themselves, their customers, and their families. If we get a report of a violation of this, we will respond to the scene. We'll document that it is in fact a violation of either a county order or a state order, and then we'll advise the proprietor of that violation, and then we'll notify the health department, and then we're clearing the scene. Now, that doesn't mean that down the road the Attorney General or some licensing action may be taken if that facility's licensed, but we're not arresting people for violations of these orders. We're not putting up barricades. We're looking to partner and help the community, so I want to be clear about that. This is not what you see in the movies. This is a way where the whole community, including law enforcement, is working together to remind people of orders that are in place and encourage them for their own safety and that of their employees to comply. So that is how we're going to handle calls and complaints relative to violations of orders. And I think it's important to know that there's continuity of operations. You know, you've seen the reports from DPD, my friend Chief Craig. They've, I think, got 152 officers down out of action. 5 were tested positive. So we're looking for ways, obviously, to protect our employees. That equipment that the county executive talked about is critical. We want to institute all of our work locations to have that touchless thermometer, so when people come to work, we can check to make sure we're not getting that spread, because we have to be on duty 24/7. Our folks can't work from home. They can't call it into the jail and say, I'm not coming in, let the inmates take care of themselves. Obviously, then we need protective equipment to test them when they come in, to help keep them safe when they're doing an incredibly tough job in a tougher circumstance. So please, if you have that equipment, that would be very helpful. All emergencies are 100% responded to. We are moving or have moved to non-emergency minor violent less crimes to be reported over the phone, so we don't have to have you or us in a face-to-face contact. We are still responding face-to-face for anything in progress or anything you need our help. But if it's, let's say, your mailbox got knocked over, that's something that can happen over the phone and reduce everyone's contact. So we're working on that kind of distancing as well. So no, we're there for any emergency, no matter what time or what situation. Lots of questions about the jail, obviously close confinement there with some potential vulnerable populations. We've been working with the courts to come up with a methodology specifically focused on some of the criteria that I actually asked the legislature to give us authority over, and that would be the medical releases, individuals that have very chronic or challenging medical conditions, like say for example an individual that we have to take out twice a day for dialysis. We have one individual that's terminally ill. Those kinds of individuals that are not a threat to the community, that have no violent history and no violent conviction, we're working with the courts to find a process to get them out of the jail, reduce some of the numbers in there, and take them from being at risk in that close confine because they've got those pre-existing conditions. But anybody that's in jail for any kind of violence or any kind of crime that isn't related to medical condition or nonviolence is not being considered. And then finally, I wanted to mention that, well not finally, actually, two more things. I communicated with the governor. I was on a call yesterday with the Department of Defense, the White House, and DHS. And one of the things I specifically mentioned, there's been discussions of call-up around the country of the Guard or activation of potentially federalizing some of that. I expressed our concern that obviously law enforcement has a lot of former and even current military. And if they do activate those folks, if there's not an exemption for first responders and even medical folks, it's going to be increasingly challenged for us to stay staffed to handle 911 calls. We get it, they need help, and certainly the governor, I think, has our Guard doing distribution of supplies and some important activities. But you know, that kind of exemption for the first responders and the medical care workers that are already engaged on the front line of this, any diminution of that kind of personnel for us today would be a challenge. So that is something we're kind of monitoring. And then finally, you know, I've mentioned this to a number of you individually before. I responded to the streets of New York after 9/11 and Katrina outside of and in New Orleans. And during both of those times, we saw the best of humanity and the worst. So the worst is evidenced itself, sadly, already. You've got scammers out there trying to take advantage of people financially. You've got people cropping up with false charities, with mirror websites that mirrored John Hopkins' Hot Map to try to get into your computer, and a host of things. I anticipate, based on what I've been told in different briefings, without getting too deep in what I can say, there will be increased potential for nation states to do some cyber kinds of things. So we all have to be aware of those frauds, those phishing expeditions on your computer, phone calls telling you I'm sick, grandma, I need some money. All of those things are already happening, sadly. So tune out anything. No one's going to ask you for your personal information or for money or compliance with anything unless you give them money right now. It's false. So tune that out. But we've also seen the best of humanity. Meyer Corporation, great corporate citizen, we work with them to feed 4 elementary schools for the last 8 years in Pontiac. They've stepped up their game, not just in Pontiac, but in 5 states to help feed folks. In fact, I'm going from here to Pontiac to give out thousands of bags of food to kids that normally would be getting school lunch programs. Meyer actually set up a thing so seniors and first responders and healthcare workers can come in first thing in the morning for an hour, a couple times a week, focused on them, to keep them from contacting other individuals, either the seniors because they're at risk, or the healthcare and the first responders because we don't want them getting infected. Let them get in and out for an hour, a couple of times a day. Kroger followed suit. So people are looking for things to do to help, and we appreciate that. Griffin Claw, right here in Oakland County, turned itself from a distillery into making hand sanitizer, and I talked to them this morning, and they're going to make us some because we're in great short supply. And with our folks, you know, out on the front lines having sanitizers and the ability to disinfect their patrol cars and do what we need to do in the jail to keep our corrections employees healthy and clean, is critically important. So we're seeing great evidence of the best of humanity. Volunteers are writing us every day saying, how can I help? I'm off work now because my job has been laid off, or I've been terminated because of this crisis, but I want to help. That's the best of humanity. That's what Americans are all about. And I thank everybody for doing that.
Thank you, Sheriff. Thank you, Sheriff. And I'm so glad you mentioned our business community, because I don't want to give you the impression, just because we're doing orders, that they haven't been extraordinary partners in this. We've had no resistance, and I am very sympathetic to the fact that there's going to be an economic hardship. Once we get our arms around this public health crisis, there's going to be an economic one. From workers who are unemployed, businesses that are worried about being able to reopen. Our economic development team is already working through plans on how we address that as we move forward. But again, we're going to be Oakland together, and frankly, it's really Michigan together. I applaud the governor and her leadership. I applaud our leadership in Oakland County, including Dave Woodward, our county chair, who is here as well. We're doing this together because as individuals, together we can stop the spread of this virus, or at least slow it. And the actions that we take today will prevent deaths tomorrow. For those who wonder if we are overreacting for nothing, I would just say nothing is good. Nothing is success. Nothing saves lives. So do as little as possible. Stay home. Reduce non-essential activities. If you're sick, stay home. Call your doctor or call our nurse on call and find out what your next steps should be. If you're a company that has inventory, like PPEs and ventilators and the like, please donate it. We'll pay for it if we need to. We're not going to let costs be a prohibitive barrier to getting these supplies into the hands of our first responders. I know that we can get through this together, but we must act together starting now. So with that, I would be open to any questions you have of me or of any of the other folks that are here with me today. Are there any questions? Yeah?
Hey, I have a few. So it seems like you are testing more people. You're having the ability to test more people.
Yes.
There's still not enough tests for everyone.
Yeah.
So are the requirements relaxing at all, or is it still you need to have some pretty significant symptoms in order to get the test?
That's a great point. The question was about testing, and more testing is becoming available daily, and I think that's part of the reason why Oakland County has seen its numbers increase. We know that we're doing additional testing. Beaumont and Henry Ford, at their facilities, they now can do testing on site. That's driving up some of those numbers as well. But we still don't have enough tests, and we still have to prioritize those who get the tests. That priority matrix can change from day to day. As we get more tests, more people can be tested. But at this point, there is a prioritization to who can be tested, and that's why you should call your provider first before you just show up at an emergency room or before you just show up at your doctor's office. You should call, because the medical community knows what the latest prioritizations are, and they can help work you through that.
So is it a safe assumption at this point of the 202 people that we know are confirmed cases that they all have significant symptoms, and that was why they were able to be tested? Is it a pretty safe assumption that they're all significant symptoms? They're not the people that we've heard of that maybe don't have symptoms at all or barely feel it.
Yeah, the question about those 202. Well, the first thing we know about those 202 people is they got infected last week or 10 days ago. Infections are happening every day in this county, and so that's a misleading number, and I think increasingly will become less significant. The number of deaths has become a much more serious barometer for me, but we will expect to see those numbers increase. And I will also say that not all of those people are in acute care, but we have people in Oakland County today that are hospitalized, that are in critical condition. This is a very serious virus, especially for the elderly, especially for those with underlying medical conditions, but not exclusively. So you should just assume that it's in every community in this county, and anyone could be at risk. You may not know that you have coronavirus. Frankly, you might think you have a mild case of the cold that could result in something more serious. You should be limiting your activities.
So we've heard a lot of talk about the elderly and the people with compromised immune systems. And I think we know that they are the most vulnerable.
Yeah.
But right now, the state health department has over 40%, something like 47% of the current cases are under the age of 50, and a significant amount. So, and we're seeing in other places that there are a lot of people who are, they survive, but they're hospitalized, their 30s and their 40s, and they're taking up hospital beds, and they are using resources. So, and I'm asking this because I think that there is sometimes a bit of a, well, it'll probably just be a mild cold for me. You know what I mean?
Yep.
So I have more leeway, and so that's a little bit why I'm asking how serious when we hear about these cases. These aren't just the mild cases, and how many of these people are in the hospital, and how many of them are not the elderly that we're picturing in our minds.
Yeah, we know that you can contract coronavirus at any age. Our youngest positive test in Oakland County is 7 months old. 7 months old. And yes, what this data and statistics show us is that the younger you are, the better chance you have of surviving it, but you can pass it on to others. You can pass it on to family members. And that's why I think what you're going to start to see us in the next coming days, do what we can to put these folks in other locations where they can keep their families safe. So if you're subacute, which means you don't need to be hospitalized, you have a safe place to go to protect your families. We have obviously a number of cases where people are hospitalized, and I'm very concerned that our hospital system will be overwhelmed shortly. So to the extent that we can identify where folks are on the symptom spectrum, the better off we'll be. Yeah.
Can you say whether that's like out of the 202, is it half the people are hospitalized?
You know what, I don't have that exact number, but a significant number of our confirmed patients are hospitalized. I don't have a specific number right now. Again, these numbers are changing hourly as we get people, and so just so you know, when we do have a confirmed case, we do a trace back, right? We're looking to see who has contact with this individual, where have these individuals been, so that we can notify, especially close contacts that may have recently been in the same room or in the same home, to really focus on, actually we will ask them, actually tell them to stay at home and self-quarantine and watch for signs and symptoms. So, we talk about the most vulnerable population, but anyone is at risk for this. And I know they're seeing those numbers now, but what we could start to see, if we can't get people to realize the importance of staying home when they're sick, not visiting your elderly grandmother or someone that's in a home. It's very hard, I understand that, right? It's very hard to say, I'm not gonna go see my 80-year-old grandmother, she's depressed, or my mom, because she can't see her family. We've got to find other ways to, Facebook, technology that exists to stay in contact with them, but not in contact, meaning going in and seeing them and possibly infecting them with the virus and not knowing you have it, because you do have just a simple cold.
Well, and the first patient that has passed away here in Oakland County is not elderly. 50 years old is not what, again, of course we know that the elderly, but that's not something that most people would have expected, I don't think.
Yeah, but I think the other thing to understand is he did have some underlying health conditions, right, which a lot of people do. So, I mean, that's why we're trying to say everyone should take this serious. This is not just one certain age group. We're seeing all age groups that can be impacted. But what we are saying is that if the elderly or that most vulnerable, we're saying kind of over 60 with those conditions that we talked about, they can have a more serious infection, which would require the hospitalization, which we talked about over-inundating our hospitals and running out of ventilators and supplies that they need. And so that's why that call that we're saying right now, we need everyone to do what they can to reduce their movement in the community if it's not essential, and really focus on their families and the people in the community that are most vulnerable.
And let me just drive that point home. My mom is 82. She'll kill me for saying that. My stepdad is 89. I'm not visiting them because I am in the public. I am exposed to people. Fortunately, right now, I'm practicing all the social distancing required to keep me safe, and I hope that continues to be the case. But I call her. several times a day. But visiting her right now is not an appropriate thing to do, and I want folks to model that behavior. I also, by the way, want to give a couple of numbers, because we talked about our Emergency Operations Center and how crucial it is that people give us supplies that they have that we could use. So I want to give the Emergency Operations Center number, which is 248-858-5300. And then the other thing that we launched just the other day is a new texting service, and I'm excited to say that 17,000 people are already receiving texts from Oakland County. So if you text OakGov to 28748, that's OakGov to 28748, we will give you on your cell phone the latest information that we have. Additional questions? Yeah.
Yeah, well, you said that you're looking for as many supplies as possible. Are you contacting everyone in Oakland County that, let's say, has a medical license of some sort to ask them if they have supplies?
You know, that's a lot of people, and we are reaching out to individuals, but that's why I'm also making the plea today, because if we don't know who you are, just yesterday the governor ordered the issue, for instance, on unnecessary dental and doctor visits. So there are going to be, you know, doctor's offices and dentist offices that are closing. We don't know who all of those people are. We do, but by the time we contact them, it's easier to just encourage them to contact us and donate those things. Thank you. Yeah.
Couple questions. First one, to your point about seeing cases across the spectrum in terms of age, are you able to provide us with either an average or median age range for the patients that you're seeing so far?
Not yet, but we're working on that, and we can get that for you. Yeah, the question was about an average or median age range. We can certainly get you the breakdown of that information as soon as we do the math.
That'd be great.
Thank you.
Another question for you. We've been speaking a lot about the shortage in terms of medical supplies.
Yeah.
Could you elaborate more where we are in that shortage? Is it critical at this time, or is it heading that way if we don't get the supplies and the community on board?
I would say it's critical now. We are not doing the number of tests that we should be doing in this country and in this state now and last week. We know that testing is a critical component. Testing and social distancing are the two most effective things that have helped in places like South Korea and Singapore and other places who have reduced their levels of infection, and we need to be doing more on that now.
What about
And by the way, on that point, I just want to say I've been in contact with the mayor of Detroit and the other big four in the region, and there's going to be additional information about increasing our testing capacity in the next couple of days. The mayor of Detroit has actually been a champion of this and has been leading an effort to help us get additional tests. I don't want to steal his thunder, but just know that we are working in coordination with the other regional leaders to see what we can do about further increasing the number of tests that we do.
what about things like masks, gowns, gloves for our healthcare?
All of that is required.
Is that-
Gowns, masks, again, these touchless thermometers, ventilators, can't say that one enough, all of that. Pardon?
Face shields.
Face shields, Leanne reminds me. By the way, I do have some additional statistics that I can share with you that have just been handed to me. So we have 229 cases in Oakland County. 42 of them are hospitalized. Their age range is 16 months, so did we have the
7 months.
I'm sorry, 7 months to 92 years. The average age is 54, and the median age is 27. That was as of 9:45 this morning.
Looking at that median age range number, with it being 27, are you seeing more younger patients than you might have originally expected to see?
We're seeing people across the spectrum, and we, you know, when we talk about the most vulnerable and our seniors, it's not that they're most likely to contract the virus, it's that they have the hardest time fighting it. So we expect to see the virus in all age ranges in the entire population. It's just that we're most worried about the people who have the hardest time of defeating the virus.
So I guess a comment, a question for the sheriff, that yeah, in a lot of the things that we're seeing in other countries too, that overwhelming of the hospital seems to be from the younger people who are getting hospitalized, and of course the older aren't surviving, but
Right.
just surviving isn't going to make. I'm just bringing this up just because I feel like some people in the public who aren't taking it maybe as seriously or thinking, well, I'm going to be fine. It's just my grandma I have to worry about. I'm just going to stay away. But they're still kind of doing whatever it is they need to do, and that can still overwhelm the medical system right, the more we get people in the hospital.
Yeah, they might be fine, but they can infect other people, and I don't think they want to be responsible for someone else's death, and that's why we ask them to take it seriously, even if they're not at risk of getting the symptoms as bad.
Sheriff, so as you know, and I know that you've heard the Detroit Police Department, they now have over 100 officers that can't patrol, that can't work because they are in quarantine, and I believe the latest number was 5 officers in one contractor with 6 who've been diagnosed, and over 100 others though that are now can't be on the streets, can't be patrolling. So what are you doing to try to prevent that from happening here?
Well, absolutely. I mean, I think the last number I saw from Jim was 152. And that's a concern. We have a bunch of our folks in quarantine because part of our process is a lot of these folks had traveled before some of this stuff went into place. They were coming back from trips. If there are any international travel, it's a 14-day quarantine. So we have a process to clear our people back to work. I was just reading emails now about a new process as it relates to future vacation for our folks. It's something we're constantly monitoring, involving to make sure that our folks don't get in a situation where they have to be quarantined even if they're not showing symptoms, but we keep them away. So if they've traveled, for example, internationally and they come back, they can't come to work for 14 days. That takes somebody offline, and we've got to fill that hole. So it is a constant struggle for Detroit, for us, and every police agency to make sure we're adapting. We're trying to do the things we need to do to keep our folks online. And obviously it's frustrating and challenging for our employees that maybe, see this as their one break from this craziness to go visit somebody in a different state, maybe their mom or dad, and then they're going to come back and we might have to move to 12-hour shifts or something. We don't even know how this will develop in terms of personnel. So, it's a delicate balancing act, but the first and foremost is staffing, and that's something we're constantly looking at to limit our exposure to situations. To your point, young people think, I may be bulletproof so I can go out, I'll be fine when it's over. But if they run into one of our deputies and our deputies gets it, that takes them offline. So every time somebody spreads it to somebody, even though that somebody may recover, doesn't mean there's not huge implications for hospital access or public safety.
Is there anything different that you guys are doing? Do you have masks? We cover scenes where you guys are at. Sometimes you have to get pretty close to people.
We don't have enough, and that goes to the request for help. We have some. We don't have enough. I was on a call yesterday. There's still not enough nationwide. What we call PPE, personal protection equipment. We had some of it already because we had to adapt to the carfentanil crisis. When our folks would come across that, airborne carfentanil could cause an overdose of our deputies. So we had a limited supply that was in each car, but that can get burned through and has been pretty quickly. So, we're trying to adapt. We're trying to keep distance. We're encouraging people. We sent out an email and said, look, if you don't have to stop a car, if it was maybe just an expired plate, that's not a critical face-to-face contact. Let's worry about that later. If it's something dangerous, sure, use your discretion, but now's not the time to be making stops and interacting directly with people that you don't need to unless there's an overriding reason connected to their behavior. If it's dangerous, absolutely. And so we're adapting all of our policies and procedures. You call our 911 center, we're asking now, we built into the phone tree, questions related to how you're feeling and symptoms. All of that's being built out. We ask that question now when you come into the jail. We have health screening in the jail, first question screening and then medical screening. We're adapting as this thing develops. And the more people can stay at home and not spread, the more likely, we'll be able to keep our folks online.
One more question.
Any other last questions? Yeah.
Going back to the median age being 27 and the younger patients, is that younger population getting hit more hard than you might have originally expected, or how are they doing overall?
Yeah. I I don't think so. I don't want to speak for Leanne. I will speak for Leanne because I know the answer to this is, no, I mean, none of us knew exactly what to expect, but, you know, having looked at what happened in China and in Europe and other places, we knew that this would affect all segments of the population. So it doesn't surprise us that it's showing up in all segments. But there's nothing unusual about younger people getting it. Everyone has the potential to get it. As I said before, the challenge is making sure that those who are most vulnerable have the resources that they need to survive it. Thanks, everybody, for coming. Appreciate